Patients need a breast augmentation with a lift when their nipples are really, really low. Nipples can be actually at all different levels. You can see either above, slightly below, way below. You can even have what's called pseudotosis, where the nipple is actually in good position, but the rest of the breast gland is low. So we have to take this all into consideration when we examine patients. When we have a patient that has nipples that are really low and they want to be larger or more augmented, then that's when we really need to think about doing a breast augmentation with a lift. If we do an augmentation alone and we don't bring the nipples up, those patients will not be happy because it will look disjointed. You really need to centralize the nipple and bring it up on top of the implant to make it look in harmony and proportional. However, it comes with a scar, and so sometimes that's really upsetting for patients to think about potentially having a scar on their breast. But they'll be more upset if they have a breast implant that's up here and the nipples are hanging down here. So the majority of patients that have the breast augmentation with lift are very happy after surgery. It is quite difficult surgery because you're actually doing 4 surgeries at the same time. You're doing an implant, and then you're doing a lift and a lift. So you basically have kind of 4 moving targets all at the same time. Again, they kind of drop and settle starting at about 3 to 6 months after surgery, and final results are probably at about a year. But there are different types of scars that you can do for doing a breast lift. Sometimes we just do a little donut mastopexy, so just a little bit of skin on the top of the areola. Sometimes we remove skin all the way around and we call that a donut mastopexy. Sometimes we just need to do a vertical incision down the front, and sometimes we actually need to do an anchor type of scar. So we have to customize based on the quality of the skin, the amount of stretch marks on the skin, the nipple position. There are many things that we have to do when considering breast augmentation with a lift, but the basic premise is that we need to centralize the nipple on top of the implant and on top of the breast to really create the best harmony.